I wanted to talk a little about lower back pain, or at least sort of around the lumbar region. And sometimes we feel that we've got this lower back pain and we think it's just like glutes, or sometimes people think it's their kidneys, sometimes people think it's lumbar issues and just the obvious. But what I wanted to show you, which I was teaching the other day, is this muscle here. Oops, let me tap on that. Actually, it's not that one. Well, yes, you've got iliacus, but I was actually I wanted to talk and show you about psoas. And the psoas muscle here is attached to the lumbar vertebrae and then inserts into the inner lesser trochanter of femur, so the head of femur on the inside. Let's just see if we can see that or around, not too well, but here. So it's from the lower back, but it's on the inside. So if you were to look at the back, you wouldn't see that. You would think, oh, my back, oops. And actually it's inside, it's internal, and this can cause a lot of stiffness. And then we also have the quadratus lumborum. Now let me just see, I think I might have to just put another layer on for the QL. Let's just pop that on. Let's just have a look. I think I can take one off for the QLs. There, quadratus lumborum. So quadratus lumborum is also an internal, so attaching to the ilium there, and then internally inside to the ribs. Can you see that there? So sometimes this also internally, because if you consider, if I was to layer on, also, has it got piriformis here? Might have to put another layer on for piriformis. Yeah, here we go. So the edge of sacrum. Nope. There's it. Oops, this one. Oops, sorry. This one here. No, these are deep, these are underneath. Let's put another layer on and see what happens there. And again, yeah, there it is. There's piriformis. So here we've got the piriformis and layered with psoas and quadratus lumborum. And then we've got here the iliocostalis. These are the erector spinae muscle, the longissimus thoracis. This is the erector spinae muscle. And but as you look deep, let's have a look at those as well. Not so much those, but this piriformis. The other thing that I wanted to show you actually is, as well as the piriformis and the iliopsoas and quadratus lumborum, if we were to layer over the nervous system, where are you, nervous system, that we have, let me just show you, we've actually got the sciatic nerve that goes through here, through this whole area. And so sometimes we think that, to just click on that, that's the sciatic nerve there. The sciatic nerve passes right through that layer of muscle, so that you've got the psoas, the QLs, the piriformis, and all these other layers. If I was to just take off and dismantle those muscles, you'll see that there the sciatic nerve passes right through everything and can compress. If this is inflamed, it compresses on the piriformis, and so you would get what's called a piriformis syndrome. If the sciatic nerve becomes entirely inflamed, then you have sciatica. But this area here, often we think we've got issues that we're not quite certain of. So I just wanted to show the muscle formations here. So if I just layer those on one more time, it'll give you a bit of an idea of the complexity and layers of muscles here that can indeed cause what looks like the lower back and around the glutes. So I hope that helps with that when you're doing your massage work, to see this layered. So any questions, just drop me a line. Thank you.